it's really important to leave the rest of the family at home. The other message that we'd like to make sure gets out is that there are times when you should seek immediate medical care, and I'd like to break those down into signs and symptoms in children and then in adults. In children, the emergency warning signs that need urgent medical care include the following: very fast breathing or trouble breathing, or a blueness around the lips, a child that doesn't take fluids as you expect them to, a child that's not as responsive as they normally are, or a child that is extremely irritable and doesn't want to be held. And if your child has been sick with flu-like symptoms that improve, and then the fever and cough return, that could be a sign of a serious complication, as could a fever returning with a rash. And those are very important times to get medical care. In adults, the emergency symptoms are slightly different, but we look for things like difficulty breathing or pain on breathing, pain or pressure in the chest, dizziness or confusion, or a severe or persistent vomiting and diarrhea, which have been associated with H1N1, particularly in adults. Thank you very much.
Well, I appreciate my physician colleagues here to introduce this media campaign. I do appreciate you all being here. This is truly a collective effort. We can't do it all at the health department, and we're so grateful that we have the private sector and the public engaged with us as well. There are some common themes that we launched as we launched this website that the speakers have already touched upon. Dr. Susan Terry spoke a lot about the importance of partnership, and we couldn't agree more. It's just essential if we're going to be successful. I think that this partnership is probably most important with the general public. Our medical colleagues or others in public health kind of understand, but unless we have a critical mass of the public that understands how to protect themselves, we're not going to be as successful as we could be in limiting the impact of this epidemic. Much of the success that we will achieve, if we can, is to get the public to take the very simple precautionary measures that have been talked about. Dr. Terry and her colleague Dr. Miner and the rest of the public health, we can't do it alone. It has to be, we need to be fully engaged with everybody. But having said that, let's get to the unveiling of what I think is going to be a very exciting and effective tool to help us limit the impact of this epidemic in our state. First of all, you'll notice the logo and the theme. You can see that we've selected Flu Fighters for our educational program. This is an empowering title, I think. It actually promotes individual responsibility. It communicates to the public that there are things they can do to fight the flu. You don't just have to wait until you get sick, or for that matter, wait to get a vaccine, which in our state is a longer wait than we were expecting. But you can do something with this theme yourselves to kind of make it more fun. Like we could say, be a flu fighter. I am a flu fighter. We're flu fighters. Whatever. We're encouraging everyone to get on board. Next, I want to point out that we will have a website that is inclusive of all of the things that we're going to, the various efforts we have. The internet will be a very valuable tool to us and has some of the individual elements of the campaign, and we encourage everyone to go to the Flu Fighter website, utahflufighter.org. In fact, I just want to say a word about that. We often hear, well, not everybody has the internet. Most people don't, or some people don't understand it. You'd be surprised, the state health clinic that I work in, serving primarily poor people, they use the web like crazy. I mean, I'm surprised how literate they are with learning how to get access to the internet, regardless of their socioeconomic status. So it'll be a valuable part of our campaign. We've got 3 simple areas for information. Prevention, that is the very basic, simple things we can do, as we've heard about from Dr. Miner, to limit the spread of the flu. Vaccination, we've got information on where to find a vaccine. I must tell you that we're kind of proud that a few weeks ago I learned that Utah and Iowa's website for Flu Finder were kind of acknowledged as some of the best in the country. You can find out the kind of vaccine and exactly where in your city and county it might be available when it is available. And what to do if you're sick. This information will help keep people who don't need to go to one of Dr. Terry's clinics. This is really, really important. We keep emphasizing that. While you've heard the signs and symptoms of where you might want to seek medical care, we think the great majority of people with H1N1 or seasonal this new novel virus, this pandemic virus, do not need to go to the doctor. In addition, we'll also have a presence on YouTube, Facebook, Twitter, and YouTube. We're very hip here at the Health Department. We're taking advantage of all of these modern technologies. Although I do find it's age-related, I couldn't Twitter if I tried, so I don't do that. But I think a lot of people do. Billboards. We're going to have 100 billboards along the highways of our state. We've employed some pretty prominent Utahns, Governor Gary Herbert and Paul Millsap of the Utah Jazz, who themselves are committed flu fighters, and we hope that the public will join them in this campaign. You can also see that we have developed a Spanish billboard. There are 11% of our population in Utah are primarily Spanish speakers, and they're a very important part of the community we want to reach out to. We've got some fun TV spots to go along with the outdoor advertising. They also feature our celebrity spokespeople. In addition to the website, we've got one commercial that focuses on vaccination and another that is on prevention. Let's take a look at them now.
I'm a flu fighter.
We're flu fighters.
Yeah!
I'm Stake Hope, so I'm a flu fighter.
I'm Governor Gary Herbert, and I'm a flu fighter, and you can be one too. Cover your coughs and sneezes. Wash your hands regularly. Get vaccinated, and stay home if you're feeling sick.
To learn the facts about the flu, how to avoid it, prevent it, and what to do if you get it, visit utahflufighters.org or dial 211.
Come on, Utah. Together we can beat this thing.
We are flu fighters.
I'm a flu fighter. No, I'm a flu fighter.
I just got vaccinated, so I'm a flu fighter.
Combate la gripe.
I'm Paul Millsap of the Utah Jazz, and I'm a flu fighter.
Be a flu fighter. Visit utahflufighters.org or dial 211 to find out who's at risk of getting the flu, who should get vaccinated, and where to go.
Together we can slam dunk this thing.
I'm a flu fighter.
Is that it? Okay, well, thank you. I don't know about you, but I've seen this message has already taken hold in some parts of our society. I had a chance yesterday to go to 2 different church services, very ecumenical. I didn't go to the Catholic Church, so I didn't get that opportunity to not drink out of the chalice or whatever they're doing to keep their sacrament more safe. But I did go to an LDS service and find out that the bishop there had said, I don't want any handshaking in our congregation. Do you understand? Bumping elbows. I call it the Indiana elbow bump. Then I went to the Presbyterian service on South Temple, where they had the annual wonderful Kirk O' the Tartans, which is a wonderful service that Pamela Atkinson and her church does. And they also got the same message. So I think that we're being successful, and encourage all of you to join with us in being flu fighters. So I think if you're ready.